Most commonly, we, certainly getting them out, so expelling them is one common thing. So, often we recommend, like, after you eat and drink anything with sugar, to kind of like rinse the mouth out so that the water is the last thing that's kind of going through there. So you can kind of rinse and gargle after you eat or drink anything with like sugars, and that can help kind of decrease some of the food particles that can get stuck back there. Good oral hygiene is important for all of these things, but that's one thing that can kind of help a little bit. Hi, this is NJENT, and welcome to the We Knows Noses podcast. I'm Dr. Smith. This is Dr. Reddy here with us. Today we're going to talk about a very common complaint, concern, and that is tonsil stones. The medical term is tonsillits, and so it's something that patients come in very frequently with and don't know what they are or what to do with them. So Dr. Reddy here to start talking to you a little bit about what they are, and what common symptoms or what you may experience if you have tonsil stones.
So this is one of Dr. Smith's favorite topics.
Oh yeah,
the tonsil stones. But tonsil stones, they're these little white things in the back of your tonsils. They get stuck there, and occasionally they come out, and patients feel like it's irritating in the back of the throat, and it can cause a lot of bad breath. Those are the most common kind of complaints we get. But your tonsils are these tissue in the back of your throat made of immune cells. It's called lymphoid tissues. And it kind of looks like a sponge in the back of your throat. And the little holes in the sponge are they're referred to as tonsil crypts. For some patients, those crypts and those holes can be longer, and it can be more tortuous, which can result in bacteria and food particles kind of getting stuck there after you're eating. And that leads to these stone formation. And when the stones are there, they can cause chronic throat irritation. It can feel like something's stuck in the back of your throat, which is referred to as globus. And it can actually even lead to acute tonsil infections. You're more likely to get a tonsillar infection if your tonsils are already inflamed and irritated by other things. So, anything to add about tonsil stones?
No, yeah, they're very common, probably more common than we know, because a lot of patients have them. But yeah, a lot of patients can not always feel them, but or not always see them, I should say, but they can feel something stuck like back in their throat. And that is a very, very common complaint. Yeah. Now, most people over time will have at some point gotten them out of their tonsils, either squeezed them out or kind of expelled them from their tonsils, sometimes with some pressure from the neck. Sometimes people will reach in just with their finger and push against their tonsil and be able to squeeze them out. People can sometimes use toothbrushes and like water picks and other things to try to flush them out, or long Q-tips to stick them out. But most commonly, patients, when they come in, know that they have a stone back there at some point because they've seen them, squeezed them out, etc. And so they come to us asking, what can we do about these? So most commonly, we certainly getting them out, so expelling them is one common thing. So often we recommend, like, after you eat and drink anything with sugar, to kind of like rinse the mouth out so that the water is the last thing that's kind of going through there. So you can kind of rinse and gargle after you eat or drink anything with like sugars, and that can help kind of decrease some of the food particles that can get stuck back there. Good oral hygiene is important for all of these things, but that's one thing that can kind of help a little bit. Certainly they make all sorts of like specialized curettes and things that you can get in there and try to scoop them out yourself, a water pick, or if you can, your finger as well, to get them back out of there. You just want to be cautious.
Speaking of that, I don't usually recommend patients go sticking stuff in their throat.
Yeah.
The reason is because your tonsils are just right next to a big artery in your neck called the internal carotid artery. And in rare situations, if you jab in the wrong direction, you can potentially cause injury to some of the blood vessels in the area.
Right.
But
Exactly. So you don't want to be blindly sticking all sorts of items back there, but it's very common that we get those as, patients have tried many different ways to get them out. So we typically recommend some sort of hygiene, whether it's, the water after the meals. Certainly if they get real big and inflamed, sometimes antibiotics can help decrease the bacterial concentration and help decrease some of these stones. So sometimes the patients will develop more of those during allergy seasons or during viruses when the tonsils get inflamed and they tend to spit more of these out. Removal of the tonsils is sometimes something that needs to be done if they're significant enough and they're causing recurrent infections and they're causing enough problems that are affecting someone's quality of life. Sometimes we'll even recommend removal of them. That's typically like our last ditch thing. We try to avoid removing tonsils at most causes, but if you're getting infections, you're having severe pain, it's causing lots of other difficulties and problems. Sometimes from these kind of chronic tonsillitis and chronic stones, we'll end up taking the tonsils out for that as well. Any other treatments or anything you want to talk about with the stones?
So in terms of conservative treatment, the water pick, I think, is probably the best thing because you're unlikely to cause any damage with a water pick. It's basically a high-pressure water system that you can buy over the counter. You can use in your bathroom, and typically it's what you picture a dentist uses to kind of clean your teeth and things, but you can aim it at the back of your throat where your tonsils are and try to clean out the stones. You alluded to taking out your tonsils, and that's kind of the last resort, and it has a high likelihood of curing the tonsil stones. There's another procedure called cryptolysis or tonsil cryptolysis, where it's kind of like a little bit more of a conservative measure than just a regular tonsillectomy where you take out your whole tonsil, and you're basically kind of from an outside in kind of shaving down some of the crypts that are the source of the tonsil stones. But the problem with that procedure is it has a high likelihood of these tonsil stones from kind of keep coming back. So generally for most people, we recommend just conservative management with a water pick and gargles that Dr. Smith mentioned. And if that doesn't improve it and it's still a persistent problem, then just getting your tonsils taken out.
All right, excellent. So I think that pretty much sums up our talk on tonsil stones. I know it's a common but nagging problem that a lot of people end up having. We'll talk about many other things as time goes on, but that's the end of our tonsil stone talk. If there's anything else, please feel free to comment or leave any questions in the comments. Please make sure to like and subscribe and join us for future podcasts.
Thanks, guys.
Take care.